Choll here from sunny San Diego, California. Another really interesting case. This is a 71-year-old retired police communications program director with a terrible back. He's had this spondylolisthesis for a long time and he's been managing it non-operatively. He did have previous laminectomies at 5'1" at least. He's got ankylosis, but more recently he had a sudden onset of severe back pain, going down the right side with weakness of the right quadriceps muscle. And you can see that the spondy's bad, but look at the level above. Look at this massive disc herniation. And same thing at the level above that. You can see that shadow of a disc herniation here. That's 2-3. That big disc herniation at 3-4. 4-5 is horribly stenotic, but he's had that for years. And we know that these two levels that have the disc herniations are the culprit because we did a targeted transforaminal epidural steroid injection at 2, 3, and 3-4 containing both anesthetic and steroid, and he got temporarily almost completely better. So it all fits, and he doesn't need a big fusion, not yet anyway. He just needs to treat these recent lesions, which are the discectomies. And given his previous surgery, his deformity, and his desire to just get the best kind of care possible and get back to life as quickly as possible, he's decided to proceed with a laser endoscopic discectomy using a transforaminal approach. So we'll do our magic at these two levels. He'll go home the same day, and hopefully in a few days he'll be back to living life again. So all hoping for a great result. Alrighty, the first step after making the perfect incision is to use the skinny little initial dilator. We call this the spaghetti noodle dilator because that's what it looks like. Well, so far so good, because this was a very difficult one to get the needle in. There's 0 disc in there. Look at that. Okay, here's the first look. You can see all the bony edges right there. First thing I look for is something called Wagner's arch. It's right here. See that little arch right there? And normally you can see into the canal, but this canal is just filled with disc. It's like a wall of disc. And after all I've done for this thing, anyway, I'm not surprised considering how big of a disc herniation you have. I find it very cool, but we've got some work to do. I wish you could have seen what I just did. I backed up the cannula and it was like popping a pimple. All this just came flying into the field. It's gonna feel so good. Look at all this material that's gonna come out. It's oddly gratifying, kind of like popping a pimple. It's gross and gratifying all at the same time. I guess that's kind of like life. There's that big bone spur that was in the back right there. This right here. Like that. This is going to be one of those disc herniations. It's going to be like my teenage kids. It's going to make me work for every single morsel. This disc is pesky. It's hiding behind a bone spur. And it's just stuck to itself. Like my teenage kids always want to argue and resist. Alrighty, so I'm on the other side of that herniation. Look at all this cockapoo right there. It's all stuck to itself. That's the it's not just a mechanical space occupying effect, it's also inflammation. Look at that. Oh, you're gonna feel so much better. And this is just the level that has the smaller disc herniation. But it's not gonna come out without a fight. Look at all that granulation tissue right there. Alrighty. It's a hot mess in here because of all the scar tissue and previous surgery, but now look at this. I can get inside here, go up and down. I see some of the nerves right there, that white stuff. So look away. Oh yeah, I'm all over this thing. Everything's nice and loose now. Next level. You're really making me work hard today. Tons of scar tissue, a gazillion bone spurs. And I'm having a bad hair day. It's like a no-look pass. I have to tell you I'm about to do it. Yeah. It's not a no-look pass. Look at this disc. There's like no disc. Okay, this level is like my teenage kids too. Will not give up without lots of fight and resistance, but I got all that scar tissue down right here. Here's Wagner's arch, and then look at this disc herniation. This is the empty tent sign. It's like nothing's in there. And I bet you there's going to be a bunch of stuff flying out of here. Look, it's like Mount Everest right here. Look at that. You can barely get in there. Yeah, it's there.
So it's as big as it
It goes from here all the way to up there. Yep, it's stuck in there. They're just coming out in lots of little pieces. Just like my punk kids. Oh yes. Sucker's pesky. Woo! I think I have some hair on my chest. So that is totally free. That is all the way to the midline. That's inferior. Oh yes, I like it. I'm going to just get a few of these loose pieces, do the radio frequency ablation, and then we'll be done with the surgery. And you'll just have 2 little vampire bites right there and 2 band-aids. It was not easy. It was like my teenage kids struggling and resisting the whole way through, but look how much this guy got out. We did it through those 2 little vampire bites, and as soon as the skin glue dries, I'm going to put these 2 little band-aids on, and then we're going to all say a little prayer for you to get better really fast so that you can get back to your busy lifestyle and enjoy this precious life that we have in this beautiful city called San Diego. So get better soon.